First of all, I'm Matt Minson. I'll be the moderator for this session. And I'd like to start off by just extending a quick thank you to the National Academies for taking on this very valid and very timely and very important subject. For those that are going to be observing and would like to engage, the rules of engagement are pretty simple. We'll have the speakers speak first. Subsequently, then there will be a period of Q&A. And because we want to maximize the opportunity for organic dialogue as much as possible with this type of venue, we'll ask that when you're posing your question, that you use the Zoom options below for Q&A. And please, if you have a specific recipient in mind for the question, designate that, or if it's a general question for anyone, please designate that as well. The observations that I think you're going to hear about are going to be directed specifically on the heels of the issues of the global pandemic. But as Providence reminds, these same issues are applicable to a number of other types of disasters. In fact, even as there are, in certain regions of the country, there are warnings and concerns regarding rolling blackouts and excessive heat, specifically heat indices of 110 and more. As well as the fact that we may actually have a hurricane forming in the Gulf. So this is not singular to COVID-19 and the issues surrounding it, but certainly there will be lessons and issues that prevail from that specifically. I want to also point out that the reminder of the purpose of this is to focus on the devastating impact to persons who have been and are of particular vulnerabilities based on racial, demographic, physical, and economic disadvantages and disenfranchisement. And so following my favorite maxim of management, which is to assemble a group of all-stars and get out of their way, I'm going to read the introductions for each of the individuals. These will be truncated. I'll point out that any pertinent publications or information that the speakers wanted to have available will be posted on the site and will be available through the National Academies. This is in no particular order, but we'll start with the introductions. These will be truncated. The full biographies will be available online as well. Our first speaker will be Marcia Ori, who is a Regents and Distinguished Professor in the Department of Environmental and Occupational Health at Texas A&M University School of Public Health. She also serves as founding director of the university-wide Texas A&M Board of Regents Center for Population Health and Aging. She's been responsible for designing and implementing interventions at the individual, organizational, and technology environmental level to improve the health and well-being of individuals across the life course. So she'll be a wonderful speaker for this. An accomplished author, she has obtained a fellow status in professional organizations such as the American Academy of Health Behavior, Gerontological Society of America, the Society of Behavioral Medicine, and she's received numerous awards such as the American Academy of Health Behavior Research Laureate, the Healthcare Leadership Council Redefining American Healthcare Award, and all of these are addressing specifically issues related to COVID-19, but in particular, and I think applicable to this, is that she is a member of the Executive Committee of the Texas A&M Emergency Management Advisory Group, which is currently addressing COVID-19. She will speak to her interest in how older adults have been impacted by the pandemic and strategies to ease those impediments. Our second speaker will be Nicolette Louisant, who is the Executive Director of Healthcare Ready, where she works to meet the most pressing patient needs before, during, and after natural disasters, disease outbreaks, and catastrophic events. She's been a senior advisor to the State Department's Special Coordinator for Ebola during the epidemic in 2014. In that role, she helped coordinate international response efforts. She currently serves as a public health representative on FEMA's National Advisory Council and as a commissioner on the Baltimore City Sustainability Commission and as co-chair of the Healthcare and Public Health Sector Coordinating Council under the Department of Homeland Security, specifically addressing supply chain issues. I think of particular note, she's also been recently named in the Route 100 Most Influential African Americans in 2020. She'll speak to supply chain issues, but she's also going to address the consideration of access to access. That is, how people can actually get to the information and the resources that are necessary, even though they may believe that that's already been accomplished. Our third speaker will be Emily Feenstra, and she is the Managing Director of Government Relations and Infrastructure Initiatives at the American Society of Civil Engineers. She leads the division responsible for government affairs, media relations, and infrastructure policy for the Society, including ASCE's Infrastructure Report Card and Failure to Act, the Economic Study Series. Previously, she served as Deputy Director of the U.S. Water Alliance and has held senior positions at the Intelligent Transportation Society of America and as consultant to the Washington State Department of Transportation. She also serves at the Enos Center for Transportation Boards of Advisors, and she'll speak to meta considerations for disasters, civil design, community design, and erasing impediments for the population. So I will turn it over happily to our speaker, our first speaker, which is Marcia Ori. And Marcia, you have the floor.
Thank you so much. I think you'll be seeing a slide, which is just an overview. I think it's always important for people to know the kinds of topics I'll be discussing. And the theme here is really the importance of community. But I believe my perspective is going to be both similar and different to the other panelists that we'll be hearing. I'm going to be approaching this topic from an aging and health perspective. And as Dr. Minchin said, I've been part of, for the last year, of our Texas A&M Emergency Management Advisory Group, and there have been nearly 200 people all across campus who come together to address different aspects of the COVID pandemic. But as director of the Aging and Population Health Center, I'm especially interested in the impacts on older adults and the population at large. Just a little bit about me. Before I came to A&M, I spent 20 years at the National Institute on Aging. That was starting as early as the 1980s. And at that time, people really didn't talk much about aging and disaster preparedness together, other than a concern about what would happen to older people in hot weather. But things have definitely changed. First of all, the older population is growing dramatically as baby boomers such as myself are aging. And secondly, there seems to be more frequent, more serious disasters of all kinds. That is, whether we're talking weather-related disasters, fires, energy disruptions, or infectious disease pandemics, epidemics. I think what's made a difference is Hurricane Katrina, Sandy, Ike, and most recently in Texas, Harvey. So we now have that as well as COVID, which has made us acutely aware of how older people are particularly vulnerable to disasters and the need for planning at all levels. But this is really an oversimplification to talk about older adults as all vulnerable. Older adults aren't all frail and disabled. They aren't all poor and isolated, as aging stereotypes may lead us to believe. In fact, our center motto is make healthy aging the new normal and debunk all of those aging stereotypes. There's so much variability among older adults that are often overlooked, but there is a population among older adults that have had special needs before disaster strikes, and the disaster would only amplify these existing problems. So let's talk just a moment and reflect, what is it that makes older people particularly vulnerable, aside from age-related chronic diseases and disabilities? And to me, it's the functional and social aspects of everyday life. It's the mobility, the ability to get around. And in some cases, we all know that our disasters call for us to evacuate rapidly and safely. It's also the ability to communicate clearly and easily. And this is in the context of a world that's becoming more online. It's having financial resources to deal with the after effects of a disaster. That is, to not only replace one's personal possessions, but also to afford temporary living quarters. And we know that going to shelters may be especially difficult for older adults and those with disabilities. What strikes me, though, as I've just said, all older people are very different, but all disasters are also different. And how they impact older people will be different too. And that is whether the message is to evacuate or to shelter in place. And so I think we're talking today a lot about COVID, and COVID has hit older people especially hard in terms of severe illness and death. And we've all heard about long-term care facilities and the disproportionate number of COVID cases. But we need to think also about the situations where older adults live more independently, but in congregate settings, like assisted living facilities or senior housing departments. These can also be potential breeding grounds for infection transmission. And we're going to be hearing, I think, a lot with one of our speakers about transforming entire cities. But I'm working with some architects who are concerned about the relationship between the environment and health at a different scale. And so what we're doing is considering indoor living spaces as well as those adjacent outdoor spaces. And what we're trying to do is to merge design and public health concerns. That is to imagine how we can make living spaces safer, but also have infection control practices in place. So we have to have these infection control practices in place, but we don't want them to impact maintaining or promoting social connectivity. We're now seeing that the public health response that was meant to protect older people had many unintended consequences. So let's think of stay-at-home orders, social distancing guidelines. They tended to only escalate an existing social isolation epidemic. And we now realize how social isolation has such negative impacts on both physical and mental health. So we need to think of solutions that will get us through COVID, but also other infectious diseases and other disabilities. What I'd like to do is shine a brighter light on public health approaches for disaster preparedness. And I'm certainly a fan of the whole community approach, and hope many of our other listeners are. And this is the idea that disaster planning needs to occur at every level, and that we need to rely on existing infrastructures, but we also need to cross those silos. For example, traditionally, those in the aging services didn't necessarily prioritize disasters, and conversely, those in emergency management didn't tailor their plans toward a full range of older adults. The whole community approach is relatively simple, but it's been hard to implement nationwide because it does involve this crossing of silos. So just to briefly talk about 3 or 4 points. You need to bring together older adults, emergency management practitioners and professionals, healthcare professionals and organizations, community leaders, government officials, to all work together to prepare and respond to emergencies. And there's an excellent toolkit that I have on the slide. It's the capacity building toolkit for including aging and disability networks and emergency planning. And I think this provides an excellent blueprint for bringing together different sectors. So what can older individuals and families do? There are excellent checklists out there that are put out by aging services organizations, public health organizations, emergency management planners, and these provide a step-by-step guide for older adults and their families. But then what can healthcare and social services providers do? And we'll be talking more about healthcare. As far as the Aging Services Network, they responded well in terms of ensuring that older adults would get services and food during the pandemic, and they have helped mobilize older adults to get vaccinated. But it's so important that the Aging Services Network, healthcare providers, emergency management planners all work together toward this common goal of preparing for and responding to disaster impacts on older adults. So what can communities do? And I'll give you an example of a problem and a potential solution. Sometimes we don't know where our older, vulnerable adults live. So when a disaster strikes, it's hard to know who's going to need what kind of assistance. And after a series of hurricanes, there has been a movement in Texas to have a voluntary registry. That is where older adults or their caregivers can self-report to a central registry so that if a disaster occurred, emergency personnel would know how to target needed services. The good news is that the system was stood up, but the bad news, and it's not so unexpected, is that over time, the personnel advocating for the registry left and no one took responsibility for its maintenance. So my parting comment is we need to learn from prior disasters, what's worked, what hasn't worked so well. We need to be able to be better prepared in the future, because the sad truth is another disaster is just around the corner. And to be prepared, we have to work harder on the whole community approach, the health and aging and all approaches. This means working really hard to be sure that older adults are well integrated into their communities, and looking out especially for those who are most vulnerable and most isolated. It means getting aging, health, and emergency management sectors all working together better. And it's heartening to me that the aging services sector is already cross-promoting National Preparedness Month, and they have special messaging about and for the aging and disability community. So while there's a National Disaster Day, a National Preparedness Month, every day of the year is a good time to get and to stay prepared for disasters. So my parting comment is, and really challenge to the group is, we all have to resolve to be at the ready at every level for all populations, but especially those who are most vulnerable. So thank you very much.
Thank you, Marcia. That was wonderful, and gives us a lot of fodder for questions, I'm sure. Just to quickly remind, because our other two speakers are queued up, we'll be keeping comments to about 5 to 7 minutes, and then we'll take questions from the group after everyone's done their presentation. So we'll go next to, I see Nicolette. Nicolette, we'll go with you next, if that's all right.
That is, thank you so much, Dr. Minson, and thank you all for the invitation and for having such an important conversation. I'm going to use slides mainly as a discipline, because I know that if without enough structure, I could certainly spend a lot of time having this conversation. And so first, just explaining who Healthcare Ready is and what we intend to do. So our organization was founded almost 15 years ago, specifically with this mandate and thinking about equity before we really centered equity as a principle in emergency management. Recognizing that if we do not have the right relationships, partnerships, and coordination, specifically between the public sector, the systems of healthcare and emergency management that have resources, and the public sector government officials that are able to identify needs, we will have patients that will suffer. We will have patients that do not have the ability to access and maintain the care that they need in a disaster. And so with that vantage point, while I'm certainly making points related to COVID-19, I think it's important that we take a few steps back and think about how we approach this for the entire system. First and foremost, recognizing that while we are talking about vulnerable populations, I would urge us to be specific about who we mean and who we are speaking to, and really appreciate Dr. Ori's remarks related to that, and thinking about aging populations and what would make certain aging populations vulnerable. Thinking about the fact that we know that there are many vulnerabilities and states of fragility that exist outside of disasters, but that we should be treating these events as flashpoints that not only stand to expose disasters, but can actually exacerbate them. And thinking about COVID in particular, we do see that there were existing health disparities as it related to chronic care that were significantly exposed, but also worsened due to lags in access to care. Increased exposure because of socioeconomic factors that had to do with the number of individuals in a household, congregate settings, also workforce and the ability or social power to be able to enforce certain parameters around one's ability to protect oneself from COVID. But also thinking about what it means to be medically fragile in the middle of a catastrophic event. So not just about sustaining chronic care, but what does it mean to already have states of fragility and medical dependence that have to be considered in the middle of a crisis, as well as the systems that need to uphold one's health in that moment. And then thinking about also surrounding environments of, medical fear and uncertainty, which are playing a large role even in the vaccination rates, misinformation and where and how people are getting information, and how that also can continue to act as contributors to exacerbating vulnerabilities. So again, taking that step back and recognizing that while we are talking about disaster preparedness and response, we do have to understand that a big part of emergency management is responding and restoring the system as it currently existed. And because I could not fit enough words in the slide to just think through all of the various isms and systems that are exposed, I'm thinking about a few specifically here and looking through the lens of racial equity. But I do want to point out that while racism is targeted here, this could also be about health equity. This could be about sexism. And these are the isms upon which we have to be honest and recognize that our systems have been built with these isms in mind. And so when we're thinking about how we actually get to a place of thinking through disaster response and reducing inequity in response, we have to understand that if we are restoring the system, we'd still be restoring the system back to a state where these systematic modes of oppression were already in place. And so if we're thinking through understanding vulnerability, points of vulnerability and inequity, we have to think about what systematic disenfranchisement has looked like for these patients and populations, and how they are navigating the system that is creating disparities as an outcome of the steady state that again is being worsened in the disaster. And so when we talk about how we work through this in the space of disaster preparedness and response, again, understanding that if our goal is upholding the system, there are various systems that have existing policies, plans, and norms that would have to be upended to just get to a place of equity prior to the disaster. And so when I'm really glad to see that Emily Fenestra will be talking about, the building of communities and societies. But when we're thinking about, again, these populations, important to understand that no population is going to interact with just one part of the system. And chances are, if they are disenfranchised in one component of the system, they are also disenfranchised in other components, which is why it's important to understand intersectionality as a term as applied to disaster preparedness and emergency management, to mean that if a patient, for example, is navigating health disparities and health inequities, they may also be navigating housing inequities and other challenges that make it difficult for them to be able to sufficiently, as an individual, prepare for and respond to disaster. And so that's where, again, these roles of infrastructure, partnerships, policies and plans that actually look at whole communities and understand the whole of society approach to understanding how we are mitigating, preparing, responding, and recovering. And so pivoting to health a little bit within that lens, wanting to think about the overall ecosystem and understanding that if we are thinking about disaster preparedness and response, not all patients will interact with all parts of the system equally. And depending on their medical needs in a disaster, there may be one part of the system that is closer in proximity to enable access to care, or more equipped to be able to deliver care. And so as we're working through disaster preparedness and response, not looking at health or health systems broadly, but really specifically thinking through the capabilities, the relationships, the partnerships, and most importantly, the trust that needs to be built and maintained between these systems and the populations that they serve. Also understanding that the more distal that facility type may be from a health system, the more proximal they may be to populations and patients that may be most fragile and most dependent on them in a disaster. As an example, lifting up the tremendous work that dialysis centers and pharmacies have done over the years to make sure that recognizing that they are dealing with medically fragile populations and often in communities that may depend on them most in a disaster, that they have to be more prepared, more resilient, and have relationships with community-focused organizations that allow for them to be able to deliver services in crisis. So as you think about centering equity and addressing how to support vulnerable populations in disasters, just want to think about this constant balance between social vulnerability and medical fragility. Often when we're talking through vulnerable populations, we may not be specific enough about the types of vulnerabilities we're thinking about, or we may not be holistic enough in thinking about, again, the balance that most of these individuals and populations may have between their social vulnerabilities and their medical fragility. We would offer from our vantage point and experience that thinking about the intersection of these two things, so thinking about those populations that may be both socially vulnerable from a systemic vantage point and medically fragile, are going to be those populations that would be most acutely impacted in a disaster and also have the hardest time recovering. And I think that's also what we've seen in COVID. So as we pivot to where we are in COVID and what comes next, again, taking all of those principles, thinking about transmission, and I know there's been a lot of conversation about this, but while we are still not out of the woods on COVID, understanding that there are still communities that are very acutely impacted right now. And as we think about what it looks like to control transmission, understanding that in this space, it really is more of a community level approach to testing, to access to monoclonal antibodies, to access to good information, but also the challenges of vaccination and understanding the root of those often being in issues related to fear and hesitancy, but also one of access, ensuring that not only is it that vaccine is at the state level, but it's actually in the neighborhoods and communities and available at the times where patients would be able to access. And then also into recovery, remembering that as we are transitioning into recovery, there have been linkages, there have been vulnerabilities that have been exacerbated through this pandemic, and we need to ensure that we have the ability to address those. And so just to wrap up, thinking about as we are understanding these patients and populations, looking at these different levels, and these are just some of the vantage points that we can bring to this, thinking about cultural, systemic, individual, and being able to balance into a community-focused disaster preparedness strategy. Thank you for your time.
Thank you, Nicolette. That was great. And we're going to open up this for Q&A. And we've got several questions already starting to collect. So really quickly, we'll transition to Emily. Emily, I'll let you go ahead and start.
Sure, thank you. Great to be here with everyone. One of the long-term benefits, I guess, or unintended consequences of the pandemic, I can join you all from home, but apologies in advance if you hear my screaming toddlers in the background. They've been coming in and out. So I'm happy to do the wrap-up remarks today and really enjoyed the prior speakers as well. And I'm here today on behalf of ASCE. For those of you that aren't familiar, we're the nation's oldest engineering society. We've got 150,000 civil engineer members in communities across the country, working on everything from ports and inland waterways to dams, levees, transit, bridges, you name it, when it comes to physical infrastructure. And I think I'll go through my slides fairly quickly, but it is helpful as far as keeping me on time. And also overall, you know, what we're seeing is a shift, I think, in the engineering community to think about communities and not just the projects that they're building, but the people that they're impacting, and just how infrastructure is such part of the fabric of quality of life. And we've been producing the report card at ASCE. I am not a civil engineer, I'm a policy person. But we've been doing the report card since 1998, once every 4 years. And it's really designed for non-engineers. It's meant to take what has been an out of sight, out of mind problem, you know, the water pipes beneath your feet, the bridges that you drive over every day, and shine a light on some of the infrastructure conditions and funding needs that we have across the country. And I think, as you can see by the nightly headlines in the news, we, along with many others, have succeeded at least in bringing infrastructure into the conversation. And now we're in the next phase of how can we do better? How can we look at decisions of the past, see how we may have impacted communities both positively and negatively, and move forward and build back better, if you will. But I did want to spend a few minutes, and I can go to the next slide, talking about just a little bit of how we do our analysis of, you know, the lay of the land when it comes to our nation's infrastructure. We have a committee of senior civil engineers from across the country and dealing with all of the sectors that I mentioned that spends about a year putting together the report. They're looking at things like capacity and condition, but also I'll just highlight public safety and resilience as well. For example, what is the infrastructure system's capability to prevent or protect against multi-hazard threats and incidents? How quickly are communities able to recover and restore critical services with minimum consequences for public safety and health? And what are we doing with innovation? This is harder to measure at a national scale. We're really trying to get more quantitative, but what new and innovative materials, designs, delivery methods, public engagement are being implemented to modernize our infrastructure? And I'll go to the grades next, just to give, again, a picture of what we're dealing with at this point in 2021. So as a parent, you know, I would not be thrilled with this grade, but it is a bit of good news that our infrastructure over the last 4 years, we've bumped up to a C-. When we look across these 17 categories of infrastructure, you can see we're taking a really holistic look at infrastructure. It's not just transportation, but also water, levees, parks, even school facilities. Schools has been a category we've looked at since the beginning in 1998. But you see, even with some progress, there's still 11 grades stuck in the Ds. In 2021, our stormwater, levees, and dams categories each earned a grade of a D. This is concerning given the role these systems play in protecting public health and safety. For example, 17 million people across the nation's communities live or work behind a levee. And those levees protect 2.3 trillion in property. They protect almost 5,000 schools. And many people in communities don't know that they live behind a levee. An example, when we look at the nation's dams, we have a growing number of high hazard deficient dams. And that can be due to a residential development that crops up next to a dam, downstream from a dam, where it used to be maybe rural farmland. So when we talk about high hazard, it's not necessarily the condition of the dam, but the consequence or the risk of life if that dam were to fail. Next, I know that there has been some statistics shared, and many of you familiar with what's happening with weather and climate disasters. We know flooding is increasing. And according to NOAA, there were 22 separate billion-dollar weather and climate disasters in the year 2020. That included 12 hurricanes that made landfall, and 7 of those were the part of that billion-dollar disaster, also a new record. One of the costly events last year was a powerful derecho that impacted most of the Midwest in August and caused $11 billion in damage. Unfortunately, we repeatedly see disadvantaged communities bear the brunt of these natural disasters. For example, a study from NYU found that the public, subsidized, and rent-regulated housing bore the brunt of Superstorm Sandy's $65 billion in damage. So what are we looking at as far as solutions? We've been doing a lot of work in addition to our policy work on design standards. I think we go back one slide, please. These design standards are key to mitigating the impacts of floods. However, building codes are frequently based on out-of-date rainfall estimates, and design standards are not adopted at the state level. NYU also found that 80% of the buildings in that surge area were built prior to 1983, the year that the most recent flood-related building codes were adopted. Because they were not built up to modern standards, older buildings were more likely to have sustained substantial damage. Some localities, such as Broward County, Florida, and Virginia Beach, have funded rainfall estimates leading to higher design standards. And one of the things that we're advocating for at AACE is to give additional funding to NOAA to update their national rainfall estimates so that all communities have access to the best information. Disadvantaged communities are more likely unable to afford these studies, much less the costly retrofitting required to bring buildings up to the new code. And of course, bearing the brunt of natural disasters is only half the story. The second question is how communities recover. After Hurricane Katrina, Louisiana relied on HUD Community Development Block Grant Disaster Recovery Program. However, it's been shown that African-American homeowners received less than white homeowners. And this discrepancy was a result of basing award amounts on housing values rather than the cost of repairs. So we're looking at tweaks in policy as we've moved forward. Certainly, the pandemic has exposed vulnerabilities, as the previous speaker mentioned. And when it comes to the physical infrastructure space, we're looking at ways that we can, bounce back from the pandemic and become even stronger. And I think another interesting thing that civil engineers and others are focused on right now is just how travel patterns have changed. Certain jobs, such as mine, I can work from home, and I might not ride transit as often now. And one thing that we've seen is, transit ridership has taken a hit. And the first people back to riding transit were in those critical service jobs, some of those frontline public works jobs and things like restaurants. And how do we make sure that transit access stays, is reliable, and that we don't see cuts to funding to that essential service? And so many infrastructure jobs are essential jobs. I will go to the next slide. I wanted to talk a little bit about school facilities. As I mentioned, we've looked at schools in each infrastructure report card. They earned a D+ in our most recent version. There's nearly 100,000 K-12 school buildings in the US. And these facilities are not only used for learning, but also for community meetings and as emergency centers and shelters. They're really community facilities. And school facilities represent the second largest sector of public infrastructure spending after highways. Yet we really have no comprehensive national data source on K-12 infrastructure. The GAO issued a limited one-time survey of school districts in 2020 and found that over half of them need to update or replace multiple building systems. Nearly 41% reported issues with HVAC systems. And then when we look at funding for schools, we can see some of those disparities play out as well. When we don't have a national centralized database, when we don't have national funding for school facilities, you can see how it becomes a system of haves and have-nots. And the schools in counties with a strong tax base and strong PTAs might see those upgrades come sooner. And that has even larger implications when we think about the multiple functions that school facilities play in the community. Briefly, to go back to our information in the report card, how can we better ensure our infrastructure withstands disasters, major storms, protects all populations, and facilitates quicker recovery? We believe a very basic first step that sometimes gets overlooked is bringing our systems back to a state of repair. And all those C's and D's on the report card translate to some pretty major investment needs. And ASE is estimated over the next 10 years, we have a $2.59 trillion investment gap across those 17 categories. And a lot of those are our legacy networks, including transit, wastewater, roads, and airports. One thing that's not reflected in this chart, but we were starting to take a look at, and I think it's accelerated because of the pandemic, is broadband. We did not issue a grade for broadband, but we called it a spotlight and just tried to uncover some of the issues around access and really evaluating level of service. And that's where civil engineers come into play, looking at the mapping of where communities have access and uncovering some of the issues where it might say that a town has access to broadband, but really the way the FCC builds maps, if there's one single house within a census block that has access, they will count the whole area as being covered. And so we know there's a lot of gaps in service that are not reflected in the current mapping. So that's a need that needs to be addressed very quickly so that we can get all communities the access to broadband that they deserve.
Emily, we're gonna probably transition into some Q&A. So if you could take 30 seconds and kind of wrap up, that way we can make sure we get, we've got a lot of questions that are posing right now. I want to make sure we get those covered.
Of course. So I'll just go to the last slide on closing. As we move forward, looking at solutions, one for ASE has always been focused on resilience. And we also have an additional initiative called Future World Vision that I wanted to mention. It's taking a long-term look at how disruptive trends such as pandemic and other issues are changing the way that our built environment needs to respond. We had been building out a visualization of what a floating city might look like, looking at the impacts of climate change, what a mega city might look like. And then one that we hadn't been paying as much attention to, but I think is more relevant than ever, is the system of smaller communities and how advances in infrastructure such as automated transit, freight networks, decentralized wastewater treatment plants could facilitate some of these smaller communities and help them to thrive. So there's lots of moving pieces right now. I think it's challenges ahead, but also exciting opportunities as we look to rebuild our infrastructure to make communities work. And with that, I will pause.
Thank you very much for that. That's fascinating. I think any one of these speakers could have spoken for an hour and we still would still have desire to hear more. I'm going to quickly transition to some of the recorded questions. I noticed that Marcia, you've answered a couple already in terms of text. There is one that was the question is kind of a general question for the support staff at National Academies, which is that the links were very long and going by rather quickly. And so the question was, is there going to be an availability of all those links so that people can benefit from the toolkits and more? I believe those will be posted on the National Academy site. And if not, I think we can probably get a firing solution on that for everybody. And we'll work on that before the end of the presentations. The first question that I've got sort of teed up, and it looks like it's a general question. It looks like it's really more towards supply chain, which is how is the equitable distribution of medical resources, vaccines, PPE, ventilators determined, and how could we improve this process to ensure that vulnerable populations have access to it? I think that probably is tailored toward Nicolette, but I believe that also affects both of the other speakers. So Nicolette, if you want to start, and then anybody else that has a dovetail, please do.
Sure. I think oftentimes we look at socioeconomic status and Dr. Minson, as we've talked about many times, often the greatest indicator in a disaster is fatalities. So if we are only looking at the number of deaths, that is often used to determine where resources need to go. So they may look at hospital bed capacity, number of deaths, and say, this is where we need to route things. What I would propose is that there's a better way to do it. And I think we need to have a better understanding of what community resilience looks like, what potential medical fragility looks like with specificity beyond who's vulnerable. To Dr. Ori's points about fragile populations within the aging population, understanding who's in congregate housing, what other needs may be, workforce points, as Emily was talking about, who is in the workforce that does not have a choice but to go to work and is using public transport, and then thinking about specifically which medical resources we're talking about. And that's what we spend a lot of time doing at Healthcare Ready. PPE, for example, is not that everyone might need the same PPE. There may be PPE that needs to get to healthcare facilities, clinics, and the like, there nursing homes. There may also be hygiene tools or just surgical masks that need to get out into the community. And so being able to actually identify what the needs are with specificity, and then focusing on which tools, which resources, which countermeasures are appropriate for those. And I think that is partially a government activity, but requires input from experts, requires input from the private sector, and really should be done in partnership.
I think that was my point of the community for all approach, that it's not just one sector, but it's everybody working together. And the best way to stay prepared in the future is doing the groundwork now and not wait for the next disaster.
Very good. I've got a question that I think is really quite pointed here, and that is there was a request for a comment on populations in homeless situations during the COVID pandemic and climate crisis issues, and if there are best practices or if someone has insights into solutions for that. That's a general. Anyone can answer that one. And no one has to.
I'm happy to take part of it, but the question was around, I just want to make sure I'm following it, healthcare delivery for homeless populations, and access to support for homeless populations amid the pandemic and the climate crisis?
Yeah.
Okay. So I think this is one of those where it really depends on which stage in the pandemic. And this is one issue that I think really became a hyper local issue very quickly, where different jurisdictions tackled how to share information, how to address housing stability for homeless and housing insecure populations during COVID in ways that really may not be sustainable. And I think most cities did not have the resources to handle this on their own. What we saw, at least at this phase, is that there was a big push specifically for the 1-dose vaccine to get that into the homeless and housing insecure populations. And I think that was a part of the last phase of the pandemic. But thinking about the climate crisis, I think that's again where you have to step back and say, these are community issues that need infrastructure and nationwide support, but it's really a systemic issue that has to be addressed prior to the event or left of boom. So as we're thinking about how homelessness has been tackled within the pandemic, I think that's one piece of it, but I think there's a broader piece as it relates to how we're going to look at the housing insecure and homeless and understand their needs systematically prior to the event. And that's, I think, a whole workshop in and of itself.
Anyone else have additional comments on that? Good. I've got one, it looks like it's tailored for Emily, and it looks like it's kind of a twofold thing. One has to do with the role of universal design, and it's rather open on that. And the second part has to do with the categorization of rail and the grade that was given for rail capability in the US. I'll add to this, there's a certain grade, and I think that the questionnaire was posing relative to human transportation, because there was mention of Amtrak versus what's done in Europe. But could you speak distinctly about whether or not the rail grade that was given was for cargo or for human transportation, or both?
Sure, great question, and we get it a lot. Because rail was our highest grade in the 2021 report card. So it is both. And I think the grade is brought up by the strength of the freight rail network. They spend about $27 billion per year investing, and when I say they, I mean the private sector, investing in rail lines, modernizing track, et cetera. But then you look at the passenger rail side, and yes, we have a lot of work to do there. It is an antiquated system, and we were happy to see, some movement in the Senate this week to greatly increase funding for a passenger rail system to kind of support that vision for Amtrak across the country. as a sustainable mode of travel to help us get to where our counterparts are in the rest of the world. You're on mute.
Thanks. Yeah, it happens. So you've already answered this in text, Marcia, but it looks like it came up. I think it's worth maybe massaging a little bit. You talked about the volunteer registry for seniors, and the question was, how well was it received? How well did it work? How was it used? And I think if you want to take a little bit of time to kind of discuss that, because that sounds like a really innovative program, and I think we'd be interested in that. You're on mute. It's your turn to unmute. Everybody does it. So
Thank you. Thank you for giving me the opportunity to speak briefly. I think it was implementable and feasible, so that's the positive. The negative is, and it was at the state level, the negative is there's no information about it. It's only in people's historical memory that this was there. Like any kind of registry, it's only going to be as good as it's populated. So I think this is, again, a situation where we need all the organizations and the older adults and their caregivers being aware of the registry, knowing how it's going to work, and then that's what's going to get them to populate. I can't tell people how it worked at the time, but it's a good idea, and I think other communities could engage in this. And one of the questions that was also there is this a community or a regional approach or a state? And I think that even though information was collected on a statewide basis, it went back to the county level. So if there was a disaster in your county, you would know the people. But these registries need to be populated and they need to be maintained.
thank you. There's a question posed specifically for Nicolette, which was, what effective strategies for CBOs serving low wealth and communities of color to receive the necessary resources to mitigate and respond to disasters? I think they're asking for what are sort of best practices and effective strategies to solution.
Sure. I'm happy to give a couple. One, lifting up the work of resiliency hubs that have been a really effective model at being able to equip, resource, and empower community-based organizations to have a role in emergency management, clarify that role, get resources, training, but being managed in partnership with the local emergency management agency, public health departments, and in places where it exists, their departments of sustainability. Also want to think through some of the dynamics that exist there. It requires funding, and it requires that there's dedicated funding so that that CBO is not put in a position of having to determine that volunteers sustain it or that resources come in, but truly that there is dedicated money for it. But it also requires political will. So if you do something that's at that type of hyper-local neighborhood level, that local government has to be supportive if all of the power is being placed in the hands of that government to make sure that there's funding and then resources going out. We've also seen that there have been a lot of initiatives at the national level, and this also ties into another question I saw in there, to make sure that there are national resources that are being disseminated locally. And that's a part of a strategy that we try to, at Healthcare Ready, be a part of, so that we can do capacity building work, training work, infrastructure support nationally, but making sure that CBOs have the resources to direct how and where those are implemented, and that they know that there are national partners that they can call on and engage, even when the local government is not willing to engage them as a partner. And that's a part of this dynamic that we have to be very mindful of. So that's a place where those national partnerships can be really powerful and come into play.
Thank you. And I know it was directed to Nicolette, but if anybody else has got additional comments on that, certainly want to avail the opportunity. I think we're closing in at, yeah, we're at 12:57. I think I've only got one kind of quick question here, which is not quick, and I'm going to pose this, I think, to Emily, which is, Are there legislative initiatives, or is there a kind of a clearinghouse for legislative initiatives relative to your report card and what actions could be taken on a state by state level?
That's a great question. And perhaps I can answer it briefly by saying, please visit our website at infrastructurereportcard.org, because we try to stay very current there with our blog and updates on what's happening on Capitol Hill and in the states related to infrastructure and communities. But, you know, a lot is happening. It's changing daily, but we're very excited to see the momentum, the new vision for infrastructure, and I would say the wider breadth of stakeholders interested in infrastructure and how it can benefit public health, quality of life, and our economic recovery.
Thank you very much. We're really kind of at the end of the hour here, and it's a shame. You were powerful speakers. I suspect that in the axiom of no good deed goes unpunished, that you're going to get a lot of people pinging you for additional information and work, which is fantastic. I'm going to answer the question that's posed initially, which is that the links will be available at the National Academies site. That is the prompt for these webinar series. So if you don't find it there, you can certainly reach out to the program personnel and get that information as well. I want to thank all three speakers. Thank you for your time. I know you're in high demand. I also want to thank you for your expertise, your service, and quite frankly, your great intellect in pursuit of all this. So in conclusion, you've done quiet heroism here today, I think. And so thanks very much. And I'll turn it back over to staff and conclude at this point. Thank you.
Sorry about that. Well, thank you everybody for participating today. That concludes our webinar for the day. Our next webinar in this series will be held July 1st, starting at 1 p.m. Eastern Daylight Time. And the recording of this webinar will be posted to the project website within a couple of days. Thank you so much and have a wonderful rest of the afternoon.